Hello. Please hit like button and subscribe my channel. Also press bell icon for future video notifications. Thanks.
Immunotherapy aims to turn the body's immune system into an ally in the fight against cancer, for instance, by stimulating T cells to identify and kill unwanted tumor cells. Unfortunately, it's not successful in every patient, as tumors can become resistant to the T cells' attacks. The mechanisms behind this resistance are varied, and new ones continue to be uncovered. But the secret to overcoming some of them might already be in medicine cabinets everywhere: antihistamines. A paper published today, November 24, in Cancer Cell reports that high levels of histamine, best known for being released in response to allergens, and one of its receptors are associated with tumor resistance to immunotherapy drugs called immune checkpoint inhibitors in patients with a range of cancers. In tumor cells, immune checkpoints are proteins expressed to evade surveillance. By inhibiting them, checkpoint therapy boosts anti-tumor defenses. The study also shows that patients who happened to be taking antihistamine treatment responded better to immune checkpoint inhibitor therapy than those not on antihistamines. Using tumor cells and mouse models, the authors further uncovered details on the mechanism behind this effect. It's just a matter of proving that with controlled trials. Becca Martin, an immunologist at the Virginia Commonwealth University who also was not involved in the research, agrees that if this intervention can be combined with immunotherapy to improve the patient's outcome, it could be a really IM. Antihistamines are cheap drugs that have been around for a long time. The goal is to make more patients benefit from immunotherapy, says Dihua Yu, a cancer researcher at MD Anderson in Texas and corresponding author of the new study. Her team first approached this quest by looking at whether common drugs consumed in combination with immune checkpoint inhibitors may influence the patient's response to this cancer treatment. By retrospectively scanning data of patients receiving immunotherapy together with any of 40 common drugs, antibiotics, aspirin, and hydrocortisone, among them, they found that melanoma and lung cancer patients taking antihistamines that target the histamine receptor H1, HRH1, such as fexofenadine, L. Based on this first promising hint at the beneficial role of antihistamines, Yu and her team explored the role that histamine and its receptor might play in the immune response to cancer. In existing patient samples, they found that high levels of HRH1 in tumors were correlated with markers of T-cell dysfunction and poor survival in patients suffering from certain cancer types. In follow-up experiments in mice, the binding of histamine to HRH1 receptors on the surface of tumor-associated macrophages contributes to the suppression of T-cell function, resulting in tumor resistance to immunotherapy. This is a sophisticated, detailed, exhaustive, and original study that provides new insights into combinatorial therapeutic approaches targeting H1 receptors to improve cancer immunotherapy. Vanina Medina, a biomedical researcher at the Pontifical Catholic University of Argentina who was not invo. Yu and her colleagues found that both histamine and HRH1 are upregulated in the tumor microenvironment, suggesting that cancer cells are one of the major sources of increased histamine levels in cancer patients. But the authors of the study also explored histamine released from allergic reactions. Based on an allergic disease mouse model and on clinical data from patients reporting allergic reactions before undergoing immunotherapy, they conclude that histamine released from an allergy response also affects response to checkpoint inhibitors. In summary, these new findings just indicate that, in some context, histamine from allergy might be important for immune evasion by the tumor, and more work needs to be done to confirm or refute that hypothesis. MD Anderson cancer researcher and study co-author Yi Xiao says these new findings provide strong evidence of the benefits of combining antihistamine treatment with immunotherapy, but still a prospective clinical trial to prove it is needed. While the team does not yet have a solid plan to perform such a study, Yu says, there is excitement among the physicians collaborating with them to start one. Please support my channel to grow by pressing subscribe button and the bell icon. We will notify you technological news. Thank you.